open in complete silence. No music, no graphics. Look directly into the camera and hold steady for 3 full seconds before speaking a single word. Right now, at this very moment, something is happening inside your body that you cannot feel. Your arteries are changing. Not next year. Not in 10 years. Right now, today, the blood vessels that carry life to your heart, your brain, your kidneys, and every organ in your body are going through a transformation that begins the day you turn 50 and accelerates with every year that passes. Lean forward slightly. Lower your voice just enough to feel like a confidence. Most people have absolutely no idea this is happening. Not because they don't care about their health, but because nobody ever sat them down and explained it clearly. I'm going to do that today, and what you learn in the next few minutes could change how you live, and how long you live. Let me paint a picture for you. Imagine a garden hose. Brand new, it's soft, flexible, and water moves through it easily with very little pressure. Now imagine that same hose left outside for 20 years. Sun, cold, heat, time. What happens to it? It gets stiffer, less flexible. The walls thicken, and if anything builds up inside, mineral deposits, debris, the opening through which water flows gets narrower. That is not a perfect comparison to what happens in your arteries, but it is closer to the truth than most people realize. Your arteries are living tissue. In your younger years, they are remarkably elastic. They expand and contract with every single heartbeat, acting as a buffer that smooths out the pressure wave your heart generates. That flexibility is one of the most important protections your cardiovascular system has. But after 50, a process that has been building quietly for decades starts to become more consequential. The walls of the arteries begin to stiffen. The smooth inner lining, which in a healthy artery is almost frictionless, can become rougher, more vulnerable to damage. Plaques of fat, cholesterol, and calcium that have been slowly accumulating can begin to significantly narrow the channel through which blood flows. And here is the danger that most people miss entirely. None of this feels like anything. There is no pain, no alarm, no obvious signal that your arteries are becoming less flexible, less open, less able to deliver what your heart and brain desperately need. Until one day, for some people, there is a very abrupt signal, a heart attack, a stroke, an event that arrives without warning, except that the warning was always there. It was happening inside the arteries invisibly for years. This is why what you're about to learn matters so deeply, because the window to act is open, but it will not stay open forever. Now I just told you that artery changes often have no symptoms, and that's true in the early stages. But as the process progresses, the body begins to send signals, quiet ones that are easy to miss or explain away. I want to walk you through the ones that deserve your attention. If you've been told your blood pressure is creeping up, or if it has been consistently elevated even though you feel fine, that number is telling you something important. About your arteries, when arteries stiffen, the heart has to push harder to move blood through them. That extra push shows up as higher blood pressure. It is one of the earliest and most reliable signs that arterial changes are underway. Many people are prescribed blood pressure medication and given little explanation of why this is happening. Now you know. The pressure isn't just a number, but it is a reflection of how hard your heart is working to push through vessels that are less flexible than they once were. This pattern has a name. Doctors call it claudication, and it is something a significant number of people over 50 experience and completely normalize. You walk a few blocks or climb stairs, and you feel a cramping, aching, or heavy tiredness in your calves or thighs. You stop and rest, and within a few minutes it eases. Then you walk again, and it comes back. This is a sign that the arteries supplying blood to your legs may be narrowed enough that during the increased demand of exercise, they can't deliver adequate blood flow. The muscles ache because they are not getting enough oxygen. People often assume this is arthritis or just being out of shape, or the natural result of aging legs. Sometimes it is those things. But this specific pattern, pain on exertion, relief with rest, needs to be evaluated. It is one of the most direct symptoms of arterial narrowing in the legs, and it often reflects what may be happening in the arteries elsewhere in the body as well. Signal number 3, occasional dizziness or lightheadedness when standing up. Have you noticed that when you stand up quickly, you sometimes feel a brief rush of lightheadedness? Maybe a slight darkening at the edges of your vision? A moment where you have to hold on to something? While this can have several causes, one of them is directly related to arterial stiffness. In flexible, healthy arteries, the vessels automatically compensate when you change positions, expanding and contracting, to keep blood pressure stable as you stand. When arteries lose that flexibility, that compensation is slower and less effective. Blood pressure drops briefly when you stand, and the brain gets momentarily less blood than it needs. That brief dizziness is the brain noticing the gap. Occasional and mild, this might be minor. Frequent, severe, or accompanied by other symptoms. It needs a conversation with your doctor. Signal number 4, erectile dysfunction in men. This is one that most men are reluctant to bring up, and it is one of the most important ones to mention. The blood vessels that supply the tissues needed for erection are among the smallest in the body, and small vessels are often the first to show the effects of arterial changes and narrowing. Research consistently shows that erectile dysfunction in men over 50 is frequently an early warning sign of broader cardiovascular disease, sometimes appearing years before more obvious heart or vessel symptoms develop. It is not just a quality of life issue, it is a potential signal from the cardiovascular system that deserves honest conversation with a doctor. Please don't let embarrassment be the reason that signal goes unheard. So why does this happen? Why do arteries change after 50? Some of it is biological inevitability. The proteins that give arterial walls their elasticity, the same ones that keep young skin supple, naturally break down over time. This is a universal process that begins in midlife for everyone. But, and this is the critical part, that natural process is dramatically accelerated by factors that are within your control. And slowing that acceleration is where your real power lies. High blood pressure is both a symptom and a cause. When the arteries are under constant elevated pressure, that pressure damages the inner lining of the vessels, making them more vulnerable to plaque buildup, which further narrows them, which raises pressure further. It becomes a cycle. Chronically elevated blood sugar, even at pre-diabetic levels that haven't yet been diagnosed, damages blood vessel walls directly. Sugar molecules attach to proteins in the arterial lining in a process that stiffens and weakens them over time. This is one of the primary reasons people with diabetes have dramatically higher rates of cardiovascular disease. Smoking, even a history of smoking from earlier in life, does lasting damage to the inner surface of blood vessels, making them more prone to inflammation and plaque accumulation. The good news is that the body begins repairing that damage within weeks of quitting, even after decades of smoking. Chronic inflammation driven by poor diet, stress, poor sleep, and excess weight, particularly around the abdomen, acts like a constant low-grade irritant on arterial walls. Year after year, that irritation contributes to the thickening and narrowing that puts the heart and brain at risk. And physical inactivity. The arteries, like muscles, respond to the demands placed on them. Regular movement, especially aerobic movement, signals the vessels to maintain their flexibility and promotes the growth of small backup pathways that can reroute blood. If a main artery becomes blocked, a sedentary lifestyle removes that signal entirely. The vessels adapt to doing less, and they become less capable of doing more when it's needed most. Here is the truth that I most want you to take away from this video. Arterial aging is real. It is happening, but it is not fixed. It is not a one-way street with no exits. The arteries are living tissue, and living tissue responds to how you treat it. Research has shown, repeatedly, that people who make specific lifestyle changes in their 50s, 60s, and even 70s see measurable improvements in arterial health. Not just a slowing of the damage, actual reversal of some of it. That is not hope. That is documented science. So let me tell you what actually works. Move every single day. You do not need to run marathons. You do not need a gym membership. You need 30 minutes of brisk walking 5 days a week. That level of consistent aerobic activity has been shown to improve arterial flow,